Dr. Parikh, this question is to you. In fact, Sneha was mentioning how, you've written your book and extensively spoken about travel and the kind of precautions one must take. Would you say it's safe to travel and take flights at this point?
Yes, but of course, again, I would qualify that with COVID-appropriate behavior. Currently, we have no indication that one should not take flights, unless, of course, you're talking about China. But elsewhere in the world, I think it would be reasonable to take flights, but one would have to mask up and indulge in COVID-appropriate behavior. There is a caveat I'd just like to add to this, and that's part of this huge problem and dilemma we are dealing with. And that is, in the current pandemic and in earlier epidemics, Chinese data has been notoriously unreliable. Either they give you something which doesn't make any sense in terms of computer models, or when it's pointed out to them, what the data they give you fits so accurately into a computer model that it doesn't happen in reality. In the current pandemic, in the last 3 years, the Chinese claim that only a little over 5,200 people have died, and 380,000 people approximately have been infected. We don't know about deaths, but conservative estimates put at 2 million people infected in China. So their numbers are unreliable, and then some of the decisions we take, Nabila and Sneha, are predicated on data. So if the data is shaky, then we have to rely on conjecture.
I think the data right now, the data coming from China, whatever data is available is good enough and alarming enough basically for us to take concrete steps.
Yesterday an organization like the World Health Organization, which has barely ever criticized China, went ahead and said that we would really want more information. We would want more data because we need this data to help you. The WHO is really fairly mum on the zero COVID policy and also on what China has been up to, vis-a-vis information on deaths and cases. They now say that we need this information.
But WHO also hasn't really sounded an alarm when it comes to especially international travel, etc. Dr. Sarin, would you want to tell us if it's really okay to plan an international trip right now? I'm very keen on understanding travel is safe.
Yeah, I think if you are vaccinated, I will again say you have a booster on your arm. You are fairly okay for traveling. Unless you are traveling to areas like some areas in Africa, or some areas in Brazil or China and maybe some parts of the world where the variants are emerging, then you are at risk. But in general, and maybe some parts of America also, in general you are okay in traveling. But yes, we have to have that mask, and remember others also in the flight should be masked. And airports are now becoming, like a busy bee area. There is so much there that we cannot protect ourselves. Remember, the new variants come up like this only. So unless we restrict our people coming to India from infected areas, we may get into trouble. And these troubles are visible after 8 to 12 weeks. So 1 to 2 to 10, like you counted, Dr. Parikh said. So we may start seeing the variants and their impact after some time. So travel is safe. But having visitors from countries which are infected or going to those countries which are infected right now should be very carefully done.
All right. And then there's a lot of buzz about I've taken my booster dose. Now with this new variant coming in and this explosion, should I take another dose of vaccine, a fourth dose? Dr. Shekhar, any advice on a fourth dose?
I'll just answer one part of it. Sorry, Dr. Shekhar. The boosters that we have as of now, the current boosters in India, as I said earlier, even for Omicron, they are reasonably well, and these boosters are better than the boosters in rest of the world where you have boosters with mRNA vaccines. Dr. Mende will certainly add to it. So when I say that it is clearly the variants that are prevalent in the world and in India, our boosters are quite well. What is lacking in the world and may create troubles are those monoclonal antibodies. People who are very fond of getting $60,000 monoclonal antibodies and get them. They would not be working on them. But our boosters and vaccines are pretty good and should be used generously.
All right. Dr. Shekhar, is the government really asking people to vaccinate again? A fourth dose? Your opinion on that?
Yeah, I think as Dr. Sarin has emphasized again and again, the boosters would be good for anyone who has not taken thus far. Certainly good for people who are elderly, people who have comorbidities and all. They must take it. But even otherwise, others also should take boosters as much as possible. And COVID appropriate behavior combined with the boosters if you have taken, I completely agree with Dr. Sareen that we are fairly safe to do travels and whatever.
You know, Dr. Mande, I want to ask you, by booster we mean the third, but Nabila is referring to the third dose of the precaution dose. She's actually not referring to the fourth dose. Her question is about the fourth dose. She's saying that I've taken 2 vaccines, I've taken the precaution dose, which is the third dose. Should I go ahead and take a fourth dose? Is the question, Nabila, am I right?
Yeah.
Yes. So if the third dose was taken about, let us say, 6 or 8 months ago, then you might as well go ahead and take the fourth dose. If the third dose was taken about a month or 2 ago, then you don't need to take the fourth dose immediately.